Hello. This series of 3 modules is about gossip, about addiction recovery in a rural community in Minnesota. This is a research study that I conducted, and I'm going to present the study to you and also describe to you the implications of the study findings for child welfare practice. First, I'll introduce myself. My name is Amy Krentzman. I'm an associate professor of social work at the University of Minnesota in the Twin Cities, and I study addiction recovery. And that's actually quite a broad umbrella of topics. I have studied spirituality, gratitude, forgiveness, 12-step programs, sober living houses, journaling as it supports addiction recovery, and the experience of getting sober in rural communities. These 3 modules I'll present today are the results of one of my studies that came out of my work studying rural recovery. I also teach addiction. I teach the elective in the MSW program at the University of Minnesota School of Social Work. I give lectures and webinars in the community quite regularly, mostly about my research. And I've created a set of learning modules for child welfare workers. I've done about 1 of these a year, and they're all listed on the CashU website. I want to pause before launching into my presentation to thank you for all you do for families and children in the state. You make a huge contribution. You make all the difference in the world to these families. I appreciate it, and the University of Minnesota School of Social Work profoundly appreciates what you do. I'd like to thank those who have supported my work in a number of ways. The University of Minnesota has provided funding to me for this research. So has the National Institute of Food and Agriculture, the Minnesota Agricultural Experiment Station, the University of Minnesota School of Social Work. I rely very heavily and with a lot of joy on my colleague and mentor Wendy Haight for her expertise in qualitative methods. What I'll be presenting to you today is a qualitative study. And a qualitative study can take years to produce. And over those years, I've worked with wonderful research assistants, and I want to thank them for all they have done. I'll start with an overview of the 3 modules in this series. In the first module, which is this one, I'm going to start telling you about the background that led to this study of gossip that I conducted. A background will start with a definition of rural, substance use disorders in rural communities, and recovery from substance use disorders in rural communities. In the second module, we're going to continue on with our discussion of the background, which is going to include the sociological construct of the idea of gossip. We're going to discuss shame and stigma in addiction and in recovery. And then we're going to launch ahead and start to tell you about the study that I conducted. We're going to start with the rationale for the study, the methods I used to conduct the study, and a description of the community and the sample characteristics. In the final module, I'm going to tell you the results of the study, which include a conceptual framework of gossip and addiction recovery in rural communities that was derived inductively from the data. That is because I used a grounded theory approach. I'll tell you all about that in the 3rd module of this series. I'll tell you also about the themes that were the basic building blocks for the conceptual framework and the quotations from the actual research participants from which I developed the themes and then used the themes to build the conceptual framework. I'll also talk about implication of this study's findings for child welfare practice, whether your client has an addiction or not. So we're going to go ahead now and move forward with the first module about background. We start with the definition of rural, and when you start to learn about how communities are designated as rural or urban, what you find is that it's not as easy as you might think, and that these terms and these definitions have changed over time. If we were together live, I would be very curious to ask you, have you ever lived in a town where everyone knows everyone? Because in this research study that I conducted, this was the defining feature of a rural community. And nearly everyone in the study said, this is a place where everyone knows everyone. And some people have lived in such a community in their lives and others have not. And I would also be curious to ask you, in your practice of child welfare, do you work in a community where everyone knows everyone or not? Which has very important implications for social work practice that we will go into. So what is the definition of rural that we are using for our study? Well, some have said that any community characterized by low population density and distance from a larger center of population, that would be considered a rural community. According to the U.S. Census Bureau, rural areas comprise open country and settlements with fewer than 2,500 residents. In this research study, we recruited from a region of Minnesota that has a great number of rural areas that meet this definition. However, we recruited participants who were most familiar or deeply familiar with a town that had less than 5,000. We felt that this definition would be adequate for answering our research questions. This definition of how a rural community differs from an urban community I found absolutely fascinating. What makes rural areas different from urban areas as it relates to addiction and recovery? It could be the composition of a person's social networks. In the social networks of rural communities, there will be fewer people you have known for less than 3 years, more people you have known for more than 3 years. You will have a smaller network size. You will have more roles per social tie. That means, let's say, that your child's 5th grade teacher is also a member of the church that you go to, for example. Your social ties are going to be more likely to be comprised of family members, and you're going to have more neighbors who are family members. And again, if we were in person, I would ask you, is this true for you? And does this ring true for you if you are someone who lives in a rural area? Let's talk a little bit about addiction and substance use disorders in rural communities. Substance use disorders are a prevalent and devastating problem across the United States. Up to 8% of the population meets criteria for a substance use disorder, and most of those people, the vast majority of those people, will have an alcohol use disorder. Overdose deaths have increased 40% in the past 5 years, and that's because of the opiate epidemic. Addiction costs the United States over $700 billion annually. So addiction is highly costly, it's very, very prevalent, and it has tremendous personal impact, both on the person with the addiction and on everyone in their social network, family, friends, co-workers, and community members. What about addiction in rural communities? We know that at one time, living in a rural community was seen as protective against drug addiction, but that is no longer the case. Now, the rural problem is seen as being as bad as the urban problem, and some have even said that the rural problem is worse. And that's because of greater opioid prescribing in rural communities, rising rates of overdose deaths, limited access to treatment in rural communities, and economic distress and social isolation, which are considered social determinants of health, which can be worse in rural communities. This is an example of the rural versus the urban problem, this is a rate of drug overdose deaths. If that could be a marker of addiction overall, let's look at how that has been playing out in terms of rural versus urban communities. On the x-axis, you will find the years. So time is modeled on the x-axis, that is the horizontal axis in terms of year. And on the y, we have deaths per 100,000 people. And as we can see, as the years have unfolded, overdose deaths have increased for rural and urban communities. Sometimes urban is having higher rates than rural, sometimes rural higher than urban, but both are increasing over time over the past several years. Let's say a word or two about recovery from addiction in rural communities. Very little previous research has focused on the experience of addiction recovery in rural communities. How do people get and stay sober in a rural community, and what is that like? So here's a quick summary of the 8 articles we found in the research literature that have studied the experience of recovery in rural communities, and these are listed chronologically. The first study we found talked about urban-rural recovery migration from New York City to rural north central Pennsylvania. People left New York City in order to get and stay sober, and they moved into a rural community to achieve that. In 2007, Grant conducted a qualitative study of 25 women in recovery in Appalachia. Haidt in 2009 interviewed 4 mothers in recovery from methamphetamine addiction. She asked them about their early lives and their experiences, and that took place in rural Illinois. Vasey in 2010 described addiction recovery in a rural Massachusetts town. Young in 2015 conducted a literature review about rural addiction and recovery. Kramlich in 2018 did an ethnography of new mothers in recovery in the Northeast United States. Palombi and colleagues conducted focus groups of people in recovery in northern Minnesota and the UP of Michigan, comparing those in early and in long-term recovery in terms of their access to what's called recovery capital, which is all the things a person needs to support recovery. Paterno also in 2019 documented the experience of women in recovery who mentor other people with addiction in rural Massachusetts. So what did these studies have to say? Taken together, these studies have identified obstacles to recovery in rural communities, but also strengths in these communities that would support addiction recovery. The obstacles included high rates of poverty and transportation difficulties, lack of community education about addiction, and poor employment prospects after treatment for individuals in recovery, lack of access to specialized training for treatment providers, difficulties accessing treatment, social isolation, a rural subculture of drug and alcohol use, negative social support, that would be social support of people who are encouraging substance use, feelings of shame and stigma, and that there were relatively fewer 12-step meetings in these communities, and thus fewer role models with long-term recovery. However, this batch of studies also spoke to strengths in rural communities that can be leveraged to support addiction recovery. The studies spoke about access to the great outdoors, being near to nature, and the beauty of the natural world. These studies talked about the presence of treatment and drug court in these communities. These studies enumerated positive individual factors such as self-reliance, resilience, having a positive attitude, and having social support from friends, family, and the community. These studies talked about informal social networks that, in this one study, that rural women had. And the studies did talk about the presence of mutual aid groups such as Alcoholics Anonymous in rural communities and the strengths that that offered in terms of support for addiction recovery. So here we come to the conclusion of module number 1. We have talked about the definition of rural. We've talked about substance use disorders in general and in rural communities. We've talked about recovery from substance use disorders in rural communities. And this concludes this module. Please join me for the second module in this series, where we will continue on with our discussion of the background that I used for my study of gossip and addiction recovery in rural communities. We're going to talk about the sociological construct of gossip. We're going to talk about shame and stigma in addiction and recovery. Then we're going to move into the details of the research study that I conducted on gossip and addiction recovery. I'm going to tell you my rationale for conducting the study. I'm going to tell you the methods I used to conduct the study. And I'm going to explain not only the sample characteristics, but the characteristics of the community in the study that I conducted. Thank you so much for your kind attention, and I'll see you in module number 2.